Good afternoon. Today I'm joined by the Deputy Chief Minister, Senator Lyndon Farnham, the Minister for Health and Social Services, Deputy Richard Renouf, and the Deputy Medical Officer of Health, Dr. Ivan Muscat. We will be setting out the latest developments in our pandemic response and outline the new measures we will be introducing. Last night, competent authority ministers met to discuss and agree new recommendations in response to the COVID-19 Omicron variant. These recommendations were made by Public Health in consultation with the Scientific and Technical Advisory Cell, or what we call STAC, as part of Jersey's COVID-19 winter strategy. Firstly, we will be implementing some changes to our border policy. So from Friday the 3rd of December, anyone over the age of 11 arriving into Jersey from outside of the common travel area, that's anywhere outside of the United Kingdom, Guernsey, Isle of Man and Ireland, will be required to isolate upon arrival in Jersey until they receive a negative PCR test result, regardless of their vaccination status or age. Whilst this will largely affect travellers arriving from France at the harbour, it will also apply to islanders who've travelled to a country outside of the CTA before transiting through the UK as part of their onward travel into Jersey. Our decision to step up the testing and isolation requirements for those travellers who have visited countries outside the CTA aligns with the position in the UK. And Jersey continues to mirror the UK government's approach relating to red list countries, requiring anyone who arrived in Jersey before the countries were added to the red list and had travelled to any of the 10 red list countries after Friday the 12th of November to book a PCR test immediately. This should be followed by a second PCR test 5 days later, regardless of whether a negative PCR test result has already been received. Islanders are asked to call the coronavirus helpline to book their PCR tests. We will continue to monitor the situation and will be reviewing the policy in 3 weeks' time to ensure the measures are proportionate. Masks remain strongly encouraged, particularly in settings where physical distancing is difficult, and ministers are currently reviewing this position. Masks remain mandatory for all islanders over the age of 12 and less exempt when using public transport, including in buses and taxis, inside of the bus station, and when inside the airport and harbour. Masks are an effective means of reducing the spread of COVID-19, and they will continue to be strongly recommended in any setting where it is difficult to physically distance or where ventilation is poor. Now, this is especially important over the winter months as the weather gets colder and we spend more time inside. Now I'd like to hand over to the Minister for Health and Social Services, who will continue the update. Richard.
Thank you, Chief Minister. Islanders will be aware of the developing situation with the Omicron variant, which has been identified in recent weeks. The government has been monitoring closely the international rapid assessments which are currently being undertaken, and there is some emerging evidence that this new variant is more transmissible than previous strains of COVID-19. We are working with the UK lab to sequence our positive cases to check for the Omicron variant, but to date, no one in Jersey has tested positive for the Omicron variant. This does not mean that we can become complacent. Like Delta, we do anticipate this variant to reach us, and so we are taking steps now to ensure we have the necessary measures in place. Therefore, ministers have decided to require any direct contact of an Omicron positive case to isolate for 10 days and undergo regular testing regardless of age or vaccine status. Ministers have also decided to make changes to our vaccine programme following advice from the Joint Committee on Vaccination and Immunisation. Therefore, we will be significantly widening the eligibility criteria for COVID vaccination to ensure that the maximum number of islanders receive the highest level of protection. To ensure we are in line with the new JVCI recommendations, we will be reducing the interval between a second dose and a booster dose from 6 months to 3 months. We will also be offering islanders aged 18 to 39 a booster dose of the COVID vaccine. And this follows our announcement last week, which saw appointments open up to all islanders aged 40 and above. Also in line with JVCI advice, we will be offering a second dose of the vaccine to 12 to 15-year-olds, and we will be providing a booster dose or fourth dose to any islanders who are severely vulnerable or immunosuppressed. Ministers are prioritising this offering as vaccination is the very best defence we have and will provide vital protection to islanders during the winter months. More details of when the expanded vaccination offering will be available to eligible islanders will be announced very soon. To enable our dedicated vaccination team to accommodate the additional demand for COVID-19 vaccination, we will be moving flu vaccines out from Fort Regent's vaccination centre. However, flu vaccination will remain available at all GP surgeries and pharmacies and is free of charge to all at-risk flu groups, including all islanders aged 50 years and over. So I urge all eligible islanders to get both their flu and COVID-19 vaccines, including boosters. All are quick and easily accessible, and it remains the very best way to maximise protection for yourself and those around you. Thank you. I will now pass over to the Deputy Chief Minister.
Thank you, Richard. As we enter the Christmas period, we are determined to ensure that all the necessary precautions are taken to protect the health and well-being of our community. However, we are also aware of the importance of this time of year to many islanders, businesses and industries, and the wish to spend time with colleagues and family and friends. As such, we are encouraging organisers of large events such as Christmas parties to ask their attendees to take a lateral flow test beforehand. All islanders over the age of 12 can participate in the lateral flow home testing scheme by signing up online to receive a free box of lateral flow tests delivered straight to their home. In the run-up to Christmas, we want to keep Jersey in business, and checking your COVID status is simple and easy. So please do play your part to protect local businesses and use the free lateral flow kits we have provided. We also previously committed to supporting businesses throughout the winter period with the Visitor Attraction and Event Scheme, the Visitor Accommodation Support Scheme, and the Fixed Cost Support Scheme, which have been extended to March 2022. The extension of the business support measures will continue to protect livelihoods and ensure that businesses who continue to be the most severely affected by the pandemic receive appropriate support throughout the winter months. These schemes, and I would like to stress, these schemes will remain under regular review. And we will, of course, keep all business support measures under review throughout the whole winter period. Thank you, and I would now like to pass back to the Chief Minister.
Thank you, Lyndon. Before we close to take questions from the media, I would just like to re-emphasise the updates we've made to our vaccination policy. So all islanders over the age of 18 are now eligible for a booster vaccine. And we've also widened the eligibility for second and third dose vaccines. That means that more islanders than ever can now get that additional protection of a second or third jab. And I really would urge you to please take up this offer. It's safe, it's simple, it's free, and it's the very best way to protect your loved ones this winter. So thank you all very much. and we'll now take questions from the media. So I believe who I've got is Julie Flanagan on the BBC, Harry, who I can see on the screen from 103, Ian McBride, there we go, in the studio from ITV, Elodie Rodule from Bailiwick, and Jack Stolt from the JP. Sorry, Jake even. So I think I will do it in that order. So we'll go for Julie first.
Good afternoon, Chief Minister. This question is for Dr. Ivan Muscat. Dr. Muscat, if you could make masks mandatory today, would you do it?
I think we need to look at all the measures that can be undertaken and continue to review those measures and introduce them as appropriate. I think that's really as far as I can go at the moment.
So you don't feel that, given the uncertainty and the risk of this variant, that it would be prudent to make masks mandatory at this point?
I think we need to keep the situation under continual review with a view to introducing those measures that we all agree are essential at the time.
Just one other question, if I may. We have been contacted by viewers who are concerned about the effects of long COVID. So what's being done to protect children and to make sure that they get as much help as possible, because the effects of long COVID are being felt here?
I'm sorry, Julie, I didn't quite catch all that you've said. Could you perhaps move the microphone closer to yourself?
Yes, can you hear me?
Thank you, that's better.
Now? Is that better?
Thank you very much.
All right. We have been contacted by viewers who are asking about long COVID. So my question is, what's being done to protect children in schools from the effects of long COVID, given that parents here are worried about that?
Well, two things really. The first is, of course, we are offering vaccination to all secondary school children down to the age of 11, 12, as you know, and now they can also have the booster. Vaccination, one vaccine offers about a 50% efficacy against catching infection. Two vaccines in that age group will take you up to about 90%. If you don't get COVID infection, you don't get long COVID. So that is a hugely important way of avoiding long COVID. Additionally, as you know, there are a number of mitigations, non-pharmaceutical interventions that are being undertaken in schools. They're less evident, perhaps, in non-school settings, but vaccination, which is our strongest defense by far and away against COVID, is of course applicable. The protective effects are applicable both inside and outside schools. And so, in summary, get vaccinated if you're eligible for vaccination.
Okay, thanks, Julie. Harry.
Thank you. Good afternoon. Staying with masks for my first question, I think people might be concerned that there's been no decision on that here today, given what we've heard in England with masks and in Guernsey with masks yesterday. So why has a decision not been made on that already? And also, are you happy, everyone on the panel, with the voluntary take-up? Because a lot of islanders aren't.
I'll try and give the high level on that, and if anybody else wants to pick that up, I'll hand it over to them. But the way the law is drafted, so making masks mandatory is then making it a legal requirement, and ultimately, if a sanction was ever taken, you're criminalising people. So what that means is that the bar to making that decision is set at a certain level. So one's got to make sure that from a proportionality point of view, that it is right and appropriate to do so. So that's why at this stage we've said, and we have been saying for a number of weeks, we strongly recommend masks should be worn. We continue to recommend that, and if you can go stronger than strongly recommending, we're saying it's even stronger than that early recommendation. The active review means that we need to understand the legal technicalities. We need to understand from a proportionality point of view whether that is then justifiable. And that's a decision, and I'm not a lawyer, and that's a decision we've got to go through the process on. And then also, if we were to go down that line, and please note that's a hypothetical at this stage, there's obviously some other steps you've got to go through. So there are some technicalities around it, which we've got to consider, and we are considering it exceptionally seriously because this is quite an important step. And it is around the proportionality in the context that we have, I think as of yesterday, 6 or 8 people in hospital. And if you remember, we are not these days focusing on the absolute numbers, although we would like to see the increase in those numbers to slow. I think that's all I can say at this stage. I don't know if anybody else wishes to add to what I've said. I'm seeing shaking of heads, so hopefully they think I've probably said enough. Do you want to go for your second question, Harry?
Sorry, just before that, can you also answer if you're happy with the voluntary taker?
I would always like to see more. I think that would be my observation. It varies, and so depending on what, I don't tend to go into shops that often these days, mainly because we're still working every hour under the sun. But on the ones, so some of the ones I've been into, the staff are wearing masks or visors, and generally customers are respecting that, which I think is good. There have been others when I've gone in and I thought actually the take-up's been fairly poor. So it does feel like in certain areas it's improving, but I think we could be doing much more. This is we're in the winter season. It is a very minor inconvenience, and it does, as far as we are concerned, it does have an impact upon reducing transmission. Okay, do you want to go to your second question?
Yes, thank you. Schools. The 2 teaching unions, the NESUWT and the NEU, have written to the government, very strongly worded, both of them, very unhappy with the rising levels of COVID cases in schools, calling for mitigations. They want mask wearing mandatory in schools, and they've also said they're very upset with the decision to revoke the PCR testing for direct contacts in school settings. Will you be making mask mandatory in schools, and will you be reinstating the PCR testing for direct contacts in education settings?
Well, I think at this stage, again, Deputy Wickenden is considering his response to the unions. Again, I would certainly like to see more masks being worn where appropriate in all the areas we've talked about. And if it's not sufficient in schools, then I'm sure Deputy Wickenden will be considering that. However, and whether he feels anything needs to be done further, bearing in mind it's about 3 weeks till the end of term. However, in relation to the PCR side, the very clear thinking on that was that was the impact that was being that we understood was having on children the disruption to education as the number of direct contacts was occurring, and given that the lateral flow test availability does give a very appropriate alternative to the PCR side. In principle, therefore, if somebody's a direct contact, they should be getting very regular LFTs for negative for a period of time. Whereas the PCR did end up in a disruption to that child's education, and therefore there's a disruption on education outcomes in theory. So that's what you're trying to protect. And interesting enough, the anecdotal feedback I've had from parents is that they very much welcomed that change. Indeed, I had understood from one of the other unions that they'd also welcomed that change. So I think we will continue to take that under advisement, bearing in mind that we've now only got 3 weeks to the end of term. Ivan, I don't know if you would like to add anything on that, if I've misled anywhere. But
Not, of course not. It's worth reminding ourselves that a single PCR within the context of the acquisition of infection and picking it up will, in that period of time, only pick up about 50% of infections because it misses a developing infection and incubating infection. It would be negative during that period. So if infection occurs, you miss it, whereas lateral flow tests undertaken on a daily basis for 10 days will pick up nearly 100% of emergent infections. So in that sense, it is the system of using lateral flow tests actually makes it more sensitive than simply using one PCR test. And of course, it is important to remember that the whole point of a lateral flow test is to pick up infectious disease, and that's what it does. And if it does so at approaching 100% of times, then that is really a very good test to have. Thank you.
Okay. Ian, do you... Okay, thank you very much. Elodie.
Hi, good afternoon. My first question is for Dr. Muscat. Last year, you gave an estimation that for every one identified case of COVID, there were 10 more in the community. I just wanted to check if the estimation still stands at the moment, and if so, could you give us an idea of how many active cases there would be in the community?
That estimate has become more difficult to establish. Hitherto, we've worked out our estimates based on hospitalization rates and what we perceived in the community. But with vaccination having such an important impact on hospitalization rates, and with the change in our testing regimes, it's actually quite difficult to estimate the proportion of cases that are out there but not detected by our system. What we do know is that the burden on the health service secondary to vaccination has diminished considerably. We would like to ensure that we keep it that way, of course, by rolling out our expanded program as rapidly as possible, and if you like, minimizing disruption as a result of the less severe infections by vaccination and by introducing appropriate non-pharmaceutical interventions. But I can't give you a current estimate of the proportion of diagnosed to undiagnosed cases.
Is it probably worth making the point that that sort of 1 to 10 ratio was back in sort of March, April of last year? We didn't think it was appropriate when we got to Christmas, for example. It was a lot narrower.
Yeah, things have changed significantly since we started, if you like, with a blank piece of canvas. It's become much more convoluted.
I understand that from what the Chief Minister just said, is that you're expecting it that the ratio would be less than 1 to 10.
I would imagine it is, but I can't tell you, I can't give you an estimate.
No, I understand that. My second question probably follow up on what you mentioned about the extended vaccination program. We know obviously that a lot of people will be mixing together around Christmas. How soon do you plan on wrapping up the vaccination and booster program to ensure as many people are vaccinated before to minimize the risk of infection? And which age group do you plan on completing before Christmas?
We are working on operationalizing the intent to give booster doses to those aged over 18, to vaccinating those in the 12 to 17-year-old age group who have not yet been vaccinated, at least to give them their first dose, because there's a 12-week gap between the first and second dose in that age group. And we will try to at least give the first doses to children down to the age of 12 before Christmas. I don't know how far we will get with the booster program for the 18 to 40-year-olds. That is being worked out at the minute. It is important to remember that the 18 to 40-year-olds were amongst the last to be vaccinated as we rolled out our initial program. And in addition, because they are younger people, they will have a stronger immune system, and therefore the waning of their immunity is less evident than it would be in the over 50s, for example, who would have received their vaccinations, their first and second doses, much earlier on this year. So that is in our favor. but we are actively putting together the resources we need to roll all this out as soon as we can.
So just to clarify, you will be focusing on giving the first dose to the 12 to 18 before you roll out the booster to the 18 to 40 people?
I think we're trying to do both. So the original plan had been to give the first dose down to the age of 12 before Christmas, and that particular program was already running and hasn't changed. The program for the boosters down to the age of 18 will be rolled out by age group, as we have done in the past, for precisely the reasons I've just been describing about waning of immunity with time and greater waning with increasing age.
Thank you very much.
As well, that obviously in terms of ramping it up, by shifting the provision of the flu vaccine, which has had a very good take-up to date, away from Fort Regent, that increases the capacity to deliver the vaccine at Fort Regent. And we were also, and I think they started yesterday, might have to be corrected on that, if they either started yesterday or they're imminent, is the vaccine, the availability or provision of vaccinations in the schools as well. So we are trying to make it increase capacity in certain areas and make it easier. Again, to get as many people vaccinated before Christmas as we can. Again, it's down to individual choice, but it's very strongly recommended. And the sooner we can get the eligible groups done, the better. Okay, I think that was your two questions, Elodie, wasn't it? So, Jake, I think.
Good afternoon. Can you reassure or even guarantee islanders that these new measures will prevent us from having a repeat of last Christmas where many businesses were shut and households could not mix?
I think the short answer is I never give guarantees. And in fact, somebody did say to me, I think in the States, somebody said we were back at business as usual. I've got a feeling it might have been last Tuesday, actually, but all the session before. And I quite clearly said we are not in business as usual. And the only thing we've learned is that we get surprises thrown at us. And unfortunately, on Thursday, the latest surprise was thrown at us in this regime. So no, I'm not going to guarantee that for the reasons having learnt previously. Our absolute aim is to keep things as normal as we can. What that comes down to ultimately is making sure that lives and livelihoods are protected. That's fundamentally does boil down to, as far as COVID is concerned, and making sure health services are not overwhelmed is one of the key factors here. And that's why we focus a lot on hospitalisations. But equally, that is a very clear message of why we would like to see the increase in numbers slow. And that then comes down to personal responsibility. So it's very much a case of that if we want to make sure that Christmas is as good as possible, it's down to us individually and collectively to act and follow the recommendations we've been putting out. If everybody did that, we would have a pretty fair chance of having as good a Christmas as possible.
Thank you for that. And second question, if it's proven that this new variant is not as serious or fatal as perhaps people have suggested it could be, would the government consider removing these new measures that they have put in place?
Oh, the point is, we've said that essentially we are reviewing this, and I think the kind of period we're working on is over the next 2 to 3 weeks, and then hopefully by then we'll have some more data, and then we'll be able to see where we are. But don't forget, some of these are obviously the red list inside, or the alignment with the red list and the UK position. I suspect that will probably take longer, but we just need to understand firstly what the position is, and obviously that data will take a good couple of weeks at least to come through. I think perhaps Ivan might be better qualified to comment on that one, actually.
Thank you, Chief Minister. Yes, it will take some time to collect the laboratory and epidemiological evidence that we need to define the characteristics of the new variant. But people are working very hard at it to define precisely what it means, but it will take some weeks.
Thank you.
Okay, on the basis that obviously ITV decided not to ask any questions, we've kind of shorten the process, I don't mind doing one more very briefly each, and then we'll draw a line. So, Julie, have you got any very brief question?
Good afternoon. If I can just check, actually, what is your advice then to people, apart from wearing masks, if you're flying into the island, not necessarily from a red list country, but from Europe, what should they do?
So if you're coming in from Europe, you'll be getting a PCR test at the border, and you'll have to isolate until you get the result. And usually, to date, the turnaround times, that's going back to what we were doing a few weeks ago, and the average turnaround time is between, at the moment, between about 8 and 9 hours. So essentially, if you come in at night, you will have your results by the time you start in the morning.
All right, thank you.
Okay. Right, Harry.
Thank you. Given the high number of cases in schools and a lot of younger children can't get vaccinated, and with this Omicron variant concern, what's the government position as to whether you'd like school nativity plays to go ahead? Should they?
Well, I think, so let's break that into two things. One is, don't forget, you've got, I'm going to say 15,000, I'm going to be wrong on that number, I'm probably a bit conservative there, pupils in school. And we are, we are significantly, I'm trying to find the actual numbers at the moment for the cases in schools, but it's in the order of between 400 and 500 from memory. I'm looking at Ivan if he's nodding.
So the total number of school positives is 466, of which 398 are students.
Yeah. So we've got to keep it in proportionality, in proportional terms, and and it's also, don't forget, it's not across the board. So you might have 3 or 4 schools might have more cases, and you might have a primary school that might have 1 or 2 cases in it. So that's where we're saying it's very much down to then the head teachers to keep assessing the position. Now, in terms of an event, and let's use use nativity as an example. Our view to date, and unlikely to change at the moment, is that what the organisers of those type of events, it could be a carol service in a church, it could be a nativity, is actually to encourage everybody who is going to have a lateral flow. If you've got that lateral flow, and particularly if you then encourage the audience to wear masks as well, depending, and they can work out what their preference is and what happens with singing, or you've got a bit of distancing in there, but most importantly the lateral flow, then to date we see no reason why that event should not take place. Again, I'll look at Ivan, just make sure I've not missed anything.
I think you're absolutely spot on. The lateral flow tests do, if you like, open the door to many activities safely, and if we just bear that in mind and use them before going to an event, before going to various venues, before going to school nativity plays and similar, then we will be able to enjoy life as normal, but safely despite COVID. Really important tool.
And just to, apologies to labour on this a bit, because I think it's quite an important point you've hit on there. Number one is, don't forget, the kits are free. If you can order online really easily, and broadly speaking, certainly our experience to date has been you'll get them the next day. If you don't have access to online in any shape or form, then I think the helpline will help you as well. But if you can do it online, it's obviously a lot easier and a lot quicker. The second point, just an example actually, you'll be colleagues in the media will know that the States of Jersey, Government of Jersey did an awards ceremony, which was in certain shapes or forms was sponsored by external parties, but for staff, and it was about celebrating the work that they had done in various areas. And from memory, there were between 400 and 500 people there. It was spaced out, it was up at the RJNHS, but it's obviously quite a large venue. It certainly was not at full capacity, so it was spacing was feasible and all that type of stuff. Point was, we made sure that everybody was very much encouraged to have had a lateral flow before they went. I think they also did temperature testing on the door, and bear in mind that was now I think 3 weeks ago, so we're out of that contact tracing period. We have had no contact tracing cases going back to that event. So that is a demonstration that you can safely hold an event. It is about making sure it is properly organised and the right measures are in place. So that is again about personal responsibility. If you're going out, I think there's 25 tests in a kit. You know, please order them, use them. You know, if you're going out 3 times a week, do 3 tests. That's the point. That's what they're there for. That's how we are shifting from sort of government side of things to personal responsibility and giving you the tool to do the job. Hope that answers your question, Harry. Okay, Elodie.
Hi, thank you. It has been more than a month since the online QR code system was taken down due to a security flaw. Could you explain who had oversight of the project and why it was given a sign-off when such a significant flaw remained, and whether the government has sought a refund from the IT provider responsible for the issue?
I think, without going into all the technicalities, we did have an update very recently on it. Part of it was around the ability to test certain things in a test environment versus a live environment. And I believe the issue, which was a technical issue, it required a collection of things to happen before there was a problem, and it was identified in a very few hours when the system went live. My understanding, and I'm going to look at Lyndon here, I've got the 15th of December in my head as in when the expectation is that it should be ready to go.
Yeah, that's the current estimated date, 15th of December. But it's worth pointing out that the COVID status certification certificates, the paper certificates that we've all been using, are readily available.
And the QR code,
and
the QR code system as well. Mm-hmm. Okay, Jake.
Sorry, you didn't address the later part of the question. Has the government sought a refund from the IT provider?
The short answer is I don't know the answer to that, and the longer answer is I don't know. The short answer, I don't know the answer to that, I'm afraid. I think it's probably quite a technical area to start getting into that sort of territory.
Okay, thank you.
Okay, Jake.
You mentioned that you felt more people could be wearing masks and adhering to the guidance. Is there a worry then that not everyone will adhere to the guidance around taking LFTs before attending an event?
Again, this comes back to this point about personal responsibility. If people, and you know, we do work on the principle that we would like as many people as possible to follow the guidance. We're also not naive enough to assume that everybody will 100% of the time. But it's about personal responsibility. We're making it as easy as we possibly can. They literally take between 10 and 15 minutes, and frankly, it's about probably from opening the package to sticking the drops in the thing is no more than 1 minute, and the rest of the time is then just waiting for the results to appear. It is that easy. And so there is really no excuse for people not wanting to do it, and then it's about personal responsibility, because you know, the whole point here is to reduce transmission, but also to try and avoid that transmission, particularly up into the older or vulnerable age groups, which we know the virus can attack. Right. Do you want to add something?
Oh, I just wanted to say on lateral flow tests. The first time I did it was a little bit daunting, but it is that simple, and just get into the habit of doing it, because after 2 or 3 it becomes almost second nature. So, and I say that because if we do that and we act responsibly, then we've got every chance of keeping business and keeping things as normal excuse me, as possible on the run up to Christmas. But I just wanted to reiterate it is get used to doing the lateral flow test, and it becomes almost second nature.
Right, on that note, we'll just wrap up very, very briefly. So can I thank members of the media for their questions, and all of you for watching. Please remember that there are practical steps we can all take to keep Jersey safe this winter, and particularly with Christmas coming. And I know you are familiar, those are familiar to you all. But in particular, as I've just said, you can order a free box of lateral flow tests to be delivered right to your door or workplace. The tests are very, very simple, they're very quick, and they will give you peace of mind when visiting relatives, going out to an event, that can be a party, that can be a carol service, and particularly enjoying a Christmas party this festive season. Can I also then just emphasise again, please follow the recommendations. Masks continue to be strongly recommended, and please, if you have not got a vaccine and you are eligible, please make that booking. Thank you for joining us today, and have a good afternoon.